Good evening to everyone and welcome to today's session. Another 75 days yet to go. Yet to go. And we're all brimming with all that enthusiasm, focus, energy, direction, spontaneity, and an incurable optimism to become the winner. So let us all study together every day and move forward. Good to see Madhuri, Deep Marwar, and many more who are all online. Please inform your friends that every day we have a live session. Generally at 6 p.m. in the evening, it may be 7 p.m., 8 p.m., 9 p.m. sometime. Life is not as predictable as it is when we are doctors, right? But still, we should read every day. Both the teacher and students should work together every day. Chai Pe Charcha with Dr. Murali Bharadwaz. So, everyday evening session, I try to discuss about 50 to 60 questions. They will give you a kind of a inspiration to go back to onlinembbs.com video library and do the revision. In addition to that, please don't forget to download the Incus quiz app. And starting from morning 8 a.m. till night 12:30 p.m., every hourly you have a live quiz tournament every day. So every month you have totally 600 quiz tournaments. You can play, you can see how you are competing with your classmates. Spardaya, Vardhathey, Viday. So that is the best way with the Incus quiz app. We want to inspire you every day, every minute, every hour to be in continuity of preparation, and above all, to touch base all the 19 subjects is most important. So let's make the great beginning, doctor. So what are the questions for today evening? 50 questions we plan to discuss. So good to see 10 online students. The patients who require antimicrobial prophylaxis against infective endocarditis. This is one list wala question. List wala question. I say list wale questions ko garma garam mutti mein rakhe, exam mein you have to sneeze it out. So tell me, doctor, wherever there is a lot of blood flow against a very high pressure, it happens in VSD. VSD is a high pressure gradient lesion. Whereas ASD is a relatively low pressure gradient. That's the reason it does not require the infective endocarditis prophylaxis is what you need to remember. Similarly, patients who have undergone splenectomy, they should also be given antibiotic prophylaxis is what you should remember. In HIV positive patients, also be given antibiotic. What is true statement? Pneumocystis carinii, no doubt, is common cause of pneumonia. Cryptococcus neoformans lead to meningitis, and Candida albicans is one of the age-defining illnesses whenever it is infecting oropharynx is what you should remember. The myocardial oxygen consumption, what is the determining factor? It is the myocardial fiber tension. The more the tension, the more the contractility, the greater will be the oxygen consumption. That is the reason those who are having hypertension, their afterload increases. So when the aorta is pumping against a high pressure, that is demanding more and more of oxygen. Similarly, aortic stenosis, aortic valve stenosis, The ventricle is pumping against a stenotic, tight stenotic valve with using a lot of pressure. That also lead to increased myocardial oxygen consumption is what you need to remember. So tension is the most important parameter influencing the myocardial oxygen consumption is what you need to remember. For the cor pulmonale, what is cor pulmonale? So cor pulmonale is right ventricular failure, which occur, not because of a problem in the heart, but because of the pulmonary hypertension. So it can be acute or chronic pulmonary hypertension leading to the right heart failure, can lead to either acute or chronic cor pulmonale is what you need to remember. So if mitral stenosis is there, mitral stenosis is less likely, but of course, mitral stenosis leads to pulmonary venous hypertension because what drains into left atrium? Pulmonary vein. So it is a pulmonary venous hypertension, but pulmonary embolism, kyphoscoliosis, COPD, they all lead to pulmonary arterial hypertension, which is responsible for the cor pulmonale, is what you need to ultimately remember. So COPD, obstructive sleep apnea, central sleep apnea, mountain sickness, primary pulmonary hypertension, they're all the various causes. Similarly, pneumoconiosis, any bad lungs with hypoxia, pulmonary vascular disease, pulmonary hypertension, thromboembolism, interstitial lung disease, etc., etc., etc. What is Dressler? Dressler is pericarditis, which develops because of the autoimmune reaction. Excuse me. Autoimmune reaction after the myocardial infarction. So when does it happen? Typically 2 to 3 weeks after the infarct. Good to see Deepthi Birla, Suhani Pathak, Madhuri, all our old gang is rejoining. Excellent, excellent. So for the past 2 months, I was a bit busy because of the launch of this Incus quiz app. I was sitting with the developers, passionately building the application, etc. Now the app is released. You can all download the Incus quiz app and can start playing. From now onwards, I'm all yours, and I spend every day evening. So inform your friends also to join our everyday daily live session to add a bit of inspiration to your preparation. Otherwise, already there are online mock tests, online video library, everything on the onlinembbs.com, which you can always do the revision. So, how does Dressler present? There will be pleuritic chest pain, fever, pericardial pleural effusions. That is how the presentation is. Once more, doctor, A wave, C wave, B wave, X descent, Y descent of the JVP. In the onlinembbs.com, we have extensively discussed about the JVP. Please take every opportunity to do a revision if you have done this question wrong. But you should remember, when the atrium is filling into the ventricle, isko kya bolte hain? Diastole, ventricular diastole. Wow, I'm so happy to see 12 online students. Once upon a time, we used to have around 200, 300 students in the daily class. I'm really sorry, guys. Last 3 months I was busy because of this Incus quiz app. Now the Incus quiz app is available in the Android. And also we have come up with the web version of the Incus quiz. So below this video, you can see the link for you to reach out to the Incus quiz app web version. So if you have any iPhone, Apple device where you are unable to use our Android Incus quiz app, even Apple is releasing in a couple of days, you still can be able to go through this web browser on the Google Chrome on any machine and can be able to start playing the quiz tournament. So I want to see all of you becoming part of our Incus quiz group and start playing the quiz tournament. We have 20 quiz tournaments every day, 600 quiz tournaments every month, almost 12,000 questions. You get a practice every month for a small subscription fee of 600 rupees of subscription fee. So please take every opportunity to subscribe, play quiz tournaments, see how you are faring with your classmates. So a wave in JVP. So why does it happen? During the last 1/3 of the ventricular diastole, when atrium is filling into the ventricle, atrium actually contracts and pushes the blood. That is typically responsible for the A wave in JVP is what you need to remember. So keep punching the answers, doctor, so that you are feeling live, vibrant, along with the teacher. You are thinking about answers, right? So where do you find dominant A wave? Whenever the atrium has to use a lot of pressure to push the blood into ventricle. That can happen if there is any pulmonary stenosis or tricuspid stenosis or pulmonary hypertension. In any of these situations, atrium has to use a lot of pressure. That leads to development of dominant A wave is what you need to remember. Any amount of discussion on JVP is today night also, entire night we can discuss on JVP. The most useless clinical finding, honestly speaking. At most in clinical practice, you will say, okay, JVP is elevated, that means right heart failure. But already by the time JVP is elevated, there is a pedal edema. Right heart failure does not require JVP elevation as an indicator. It is not a sensitive indicator as a physical sign. But in entrance exam, they keep on beating you on the topic of JVP. So you have to be very good with. Wide fixed split. So normally the second heart sound, if you take, it is because of the closure of aortic valve on left side and pulmonic valve on right side. Generally, aortic valve closes first, pulmonic valve later. Between them, there is a gap. That is called a normal split. But those who are having atrial septal defect, there is a lot of blood of the left atrium going into right atrium. Because of that, the regular venous return plus this extra blood from the left atrium together will further delay the pulmonic valve closure. That's the reason the pulmonic valve closure will be more delayed, and that will widen the split. So wide fixed split of the second heart sound is synonymous with atrial septal defect is what you need to remember. But the most important etiology in coronary artery disease, obviously it is the LDL, which is the culprit. Whenever there is any tricuspid incompetence between right atrium and right ventricle, you have tricuspid valve. If there is a tricuspid regurgitation, what will happen? Obviously, any tricuspid regurgitation will increase the pressure in the right atrium. Who is draining in right atrium? Superior vena cava, inferior vena cava. From where is inferior vena cava coming? From the liver. The hepatic vein drain into IVC. So any tricuspid regurgitation increase the pressure in the right atrium, increase the pressure in the IVC, increase the pressure in the hepatic vein, which is draining the liver, and that lead to hepatic pulsations is what you need to remember. Now, doctor, about rheumatic fever, secondary prophylaxis of a 6-year-old child. How long do you want to give the prophylaxis is an important question. So typically it is till 25 years the child achieves the age. We give the prophylaxis. How do you judge the severity of mitral stenosis? You should remember, in mitral stenosis, what kind of murmur do you have, doctor? Mid-diastolic murmur. The duration of this murmur is an indicator of severity of mitral stenosis is what you need to remember. So, there are various ways by which you can be able to judge the severity of the mitral stenosis. One value is called pressure half time, which you calculate on echocardiography. So, the mitral valve area, normally it is 4 to 6 centimeters square. 1.5 to 2.5 is mild, 1 to 1.5 is moderate. Less than 1 centimeter square of the mitral valve area is basically considered to be a severe mitral stenosis. This is one of the favorite MCQ, right? Now, end diastolic pressure gradient. Obviously, when there is a mitral stenosis, there is a problem when the atrium blood is moving into ventricle. That is when ventricle is undergoing diastole. So the end diastolic pressure gradient, end of the diastole, the blood is supposed to empty into ventricle and fill into the ventricle and empty from the atrium. But it does not happen like that if there is a mitral stenosis. That creates a end diastolic pressure gradient. It is more than 10 millimeters of mercury. It is called a severe mitral stenosis is what you need to remember. Similarly, across the mitral valve, what is the mean pressure gradient is an indicator of severity of mitral stenosis. More than 12 millimeters mercury, it's called severe mitral stenosis. So, P wave, QRS, T wave. So this is called ST elevation. So where do you find ST elevation? Normally ST elevation is an indicator of myocardial infarction. But it can also be seen diffusely in multiple leads in acute pericarditis, principal angina also. You should know what are all the causes of ST segment elevation. So, how do you identify acute pericarditis ST elevation? It is concave upwards. It is concave upwards. And there is no reciprocal ST depression. That is how you identify the acute pericarditis. Similarly, any left ventricular hypertrophy, left bundle branch block, any advanced hyperkalemia, hypothermia, anything can lead to development of ST elevation is what you need to remember. So winning entrance exam is more and more and more to do with focused 953 topics from 19 subjects. अगर वो 2020 का हो या 2050 का हो NEET PG entrance, ये 953 topics are like a Bible for you. As a Pope of PG entrance, I am telling you, these 953 topics. If you don't have those 953 topics, don't forget to call our helpline 9000-868-356 and try to get the 953 topic list. A 953 topics पढ़ने के लिए आपको लगेगा कितना टाइम लगेगा? Maximum you will take to achieve these 953 topics. For you to achieve, you won't take more than 300 hours of time. Still you have 75 days left. If you spend 4 hours a day also, you can still master it. I'm so happy to see 14 online students. Kalka class I have delivered to around 5 or 4 students. I was thinking, अरे कहाँ चले गए हमारे पूरा आबादी? हाँ, हम 2 महीने से नीट पीजी के शहंशाह जंग को आना भूल गया, तो इसलिए हमारा पूरा परिवार हमको भी भूल गए. So we are back into the game and more strongly now with Incus quiz app. Okay, doc? So you all download this. You have 12,000 questions per month, 600 quiz tournaments. Each 20 question wala quiz tournament. Every day 20 quiz tournaments covering all 19 subjects where you can have a competition with all your friends. Please do subscribe to this Incus quiz app and try to play the quiz tournaments and check your preparation. So morning 8 a.m. we have anatomy, 9 a.m. physiology, 10 a.m. biochemistry. Like that until night at 12:30 p.m. you have every hourly 20 question quiz tournament. After the quiz tournament is over, the questions will go into history and you can always have a review. You can know how your other friends are attacking the concepts. So almost you get a revision of Kelte 12,000 questions every month. Just for 600 rupees of subscription fee, small fee. Continuous murmur, we find it in AV fistulas. So pregnancy, beriberi, anemia, thyrotoxicosis, AV fistulas. You should know the list of causes of continuous murmurs which extend from systolic towards diastolic phase is what you need to remember. Swan-Ganz catheter, what are you measuring? So basically, from the right atrium, you go into right ventricle. From right ventricle, you will go into pulmonary artery. From pulmonary artery, you are reaching the pulmonary capillaries. Ultimately, what pulmonary capillaries are doing, doctor? Good to find Harish Ramachandram after a long time. All these pulmonary capillaries are opening into left atrium. That's the reason pulmonary capillary wedge pressure, which is measured by the Swan-Ganz catheter, is an indirect indicator of the left atrial pressure, is what you need to basically remember. Barabar? So it is used to measure pulmonary capillary pressure. So what is the definition of ARDS, acute respiratory distress syndrome? How do you differentiate it from congestive heart failure? Acute respiratory distress syndrome is non-cardiogenic pulmonary edema. So non-cardiogenic pulmonary edema. It is not because of cardiac failure. How will you know that? If you calculate the pulmonary capillary wedge pressure in a patient of ARDS, it is a normal pulmonary capillary wedge pressure that defines the ARDS, is what you need to remember. Erysipelas is Streptococcus pyogenes. Allostreptology. In fact, if I ask you a question, one of the favorite MCQ in the exam, What is the commonest congenital cyanotic heart condition presenting after the first year of life? After the first year of life. Fallow. In tetralogy of Fallow, aortic incompetence can be associated and it can lead to development of a diastolic murmur. What is the diastolic murmur of aortic regurgitation normally? When it is very severe, it is called as Austin Flint murmur. It will occur only when there is a severe AR. A large aortopulmonary collaterals will produce a machinery murmur. So that is the story of Fowler's tetralogy. If you look at the pulmonary stenosis, it leads to an ejection systolic murmur, not a pansystolic murmur, is what you have to remember. Now, what is wrong about pulmonary hypertension? It can be caused by atrial myxoma, sickle cell disease, left ventricular failure. They're all true. Idiopathic form is most commonly seen in females. Typically, females with idiopathic pulmonary hypertension present with fatigue, diffuse parasternal chest pain, etc., etc. So, idiopathic unknown etiology, pulmonary hypertension most commonly seen in women, but very commonly pulmonary hypertension is seen in chronic lung disease, left to right intracardiac shunts, and pulmonary venous hypertension, obstructive lung disease, etc., etc. They are the causes. Endocarditis prophylaxis. Once more, doctor, I'm so happy to say our Incus quiz app today onwards is even available as a web link. You can go to the Google Chrome, type this link that I gave, you will land in a page, and there once you log in, you can be able to see the games and you can be able to play the games. Okay? Now, endocarditis prophylaxis, where is it required? It is required for abdominal surgery, gynecological surgery, ENT surgery, not in minimally invasive surgeries. Dominant R wave in V1. So doctor, आपको एक बात याद रखना, V1 होता है right sided lead, V6 होता है left sided lead. So our mean electrical axis कैसे जा रहे? V1 को छोड़ के V6 की तरफ जा रहा है, ऊपर से नीचे जा रहा है. So whenever the depolarization is leaving a lead, it will show negative deflection. Whenever depolarization is reaching a lead, it will show a positive deflection. Positive deflection को हम बोलते हैं R wave. इसलिए R wave is expected in the QRS complex. R wave is expected in typically V6, left-sided lead, not in the right-sided lead. But if there is a R wave in right-sided lead, what does it indicate? Maybe there is a dextrocardia, is what you should understand. Then the direction is towards right. Then that leads to a dominant R wave in V1. Of course, there are many other causes for the dominant R wave in V1. We discussed it in a great detail in onlinemmbbs.com video library. There is a topic called ECG. Now, first degree heart block, when do you call? When the PR interval is more than how much? If it is more than 5 small squares. So each small square is equal to 40 milliseconds. So 0.22 seconds से भी ज्यादा है तो PR interval, इसको कहते हैं first degree heart block. So once more, Mobitz type 1, Mobitz type 2, second degree heart block, how will you recognize? Everything on ECG. You have to be very good doctor. Mitral valve prolapse. So typically in mitral valve prolapse, what is a very important feature of mitral valve prolapse? It can be seen in Turner osteogenesis imperfecta. Hypertrophic cardiomyopathy with WPW syndrome also is associated with MVP, is what you need to remember. So it is the ostium secundum type of ASD which is associated with MVP, not the primum type, is what you have to remember. With regard to digoxin, digoxin is a steroid analog. It can be used in pregnancy because it does not lead to any teratogenicity. Withdrawal of digoxin reduces the quality of life in the patients who have heart failure who are using the digoxin. But digoxin has very little impact on the heart rate during exercise. First of all, why do you use digoxin? Digoxin has a vagomimetic effect. It will delay the AV node. By doing so, it will make the AV node refractory. By doing so, it will decrease the ventricular rate. Ventricular rate. But if you are exercising, your catecholamine sympathetic drive is acting on AV node. That time, your digoxin's vagomimetic effect will be overdriven by the sympathetic. Sympathetic hota hai more powerful than parasympathetic. That's the reason digoxin cannot slow the heart rate during exercise. Resting heart rate, it will slow down. Yaad rakhega na? Favorite question of the exam. At the end of the QRS complex, development of the waves which are positive deflections, where do you see? We see it in hypothermia. In hypothermia. So you should know what are Osborne waves, what is meant by camel humping, camel hump waves. There are a lot very interesting questions in ECG. So please go to onlinembbs.com video library and then do a quick revision. Which of this lead to hyperkalemia? Amyloid typically lead to development of hyperkalemia. It is a potassium sparing diuretic and it can lead to development of hyperkalemia. Similarly, Conn syndrome is hyperaldosteronism. Aldosterone lead to sodium retention, potassium loss into urine that lead to hypokalemia. Okay, now Holmes-Addis pupil versus Argyll-Robertson. Holmes-Addis hota hai unilateral dilated pupil with very little reaction to light. There is incomplete constriction to convergence. Whenever eyes are converging, constriction, that is incomplete, commonly in the females. Whereas in posterior communicating artery aneurysm, there is an oculomotor palsy that lead to a dilated pupil, but that is not Holmes-Addis. Barabar? Now, what is pseudobulbar palsy? So typically the cranial nerve nuclei, midbrain, what do you have? Third, fourth. Pons, fifth, sixth, seventh. Eighth, ninth, 10th, 11th, everything else is in medulla. So here the brain, typically there are fibers which come. They are called cortico-bulbar fibers and innervate this cranial nerve nuclei. in the medulla. इनको बोलते हैं corticobulbar fibers. बराबर? But the corticobulbar fibers, अगर एक cranial nuclei को लिए तो both the right and left, from both the directions, the corticobulbar fibers come and innervate. So if this has to suffer a upper motor neuron type of palsy, unless bilateral corticobulbar damage is there, the cranial nuclei, bulbar nuclei do not suffer a UMN type of. UMN means corticobulbar interruption leading to upper motor neuron where there is a spasticity. Lovepreet Singh rightly says, reading neurology is like standing in a Wall Street and watching the electrical pole waves. Nobody understands to which side they will go. Correct? Absolutely right. Only electrician will know that. You should be a good electrician. If you are that, then the neurology is like a mathematics. Absolutely 2 + 3 is equal to 5. Looking at the dilated pupil, looking at the side the tongue is twisted, looking at the spasticity, looking at the clinical features, like a mathematician, you can say, hey, this is the spot I am expecting lesion. When you take MRI, on that spot you will have it. So the whole medical subject is like that. When we are all medical students, we'll see our professor 1 minute बात करेगा और prescription लिखेगा, next line of action क्या करना बता देगा. हम सोचते हैं कि अरे भाई इतना बड़ा हिस्ट्री लेने के लिए हमको बोलता है, ये तो खाली 2 प्रश्न पूछता है और ट्रीटमेंट शुरू करेगा. कैसा? There is no creativity honestly required in practicing medicine. It's all very standard, protocoled, observational, common sense, more than that, with a good ear to hear the patient's misery. More and more you are listening to the story, you will be knowing the next patient falls into a pattern. Based on the pattern, you will get that sixth sense that, hey, this is a case of multiple sclerosis. Bhimaya is having multiple sclerosis because Ramaya, Mallaya, everyone, they all presented similarly. They too were dragging their legs, they too had a diplopia. That's how you will get yours. So it's a question of keep on talking to the patients and understand their history. That makes you a great clinician one day. And constantly, whenever your diagnosis has gone wrong, you need to go back to the bed, once more take the history, once more examine, and then identify where you've gone wrong. Once you make it a practice, you are all some of the best clinicians in making. Right, doc? Now, pseudobulbar palsy lead to spastic tongue, dysarthria, emotional lability, etc., etc. So the gag reflex, palatal reflex, these two are preserved. That's the point you need to appreciate. Whenever carotid stenosis is there, internal carotid artery, what is originating? Ophthalmic artery is a branch of internal carotid artery. So the moment internal carotid stenosis is there, ophthalmic is first to get affected, and that lead to emerosis fugax. Oh, doctor, the curtains are falling before my eyes, the patient will say. Now, the clinical features of TIA, which is affecting the posterior circulation. What are the clinical features? Dysarthria, ataxia, transient global amnesia. You should know the two vertebral arteries combine to form basilar artery, which divide into posterior cerebral artery on both the sides. इस सबको बोलते हैं posterior circulation. So dysarthria, ataxia, transient global amnesia, they're all the part of the PCS strokes. So diplopia, vertigo, vomiting, choking, dysarthria, ataxia, hemisensory loss, hemianopic visual loss, transient global amnesia, tetraparesis because pons is affected. So they're all the features of the posture circulation stroke. Once more, cerebrovascular accident, stroke is the favorite topic of the examiner. What is wrong about benign intracranial hypertension? There is no mass lesion. Ventricular size is normal. It is a young obese woman with menstrual irregularities where you see the benign intracranial hypertension is what you need to remember. Steroids are implicated as a possible cause. How do you treat it? Thiazide diuretics will reduce the intracranial pressure. Even weight reduction is very important. That's the point you need to understand. Giant cell arteritis. Typically, patient will complain, I'm having throbbing pain, doctor, which is worsened by eating, claudication of the jaw. Arterial pulsations of the superficial temporal artery are lost. And one side of the spectrum we call polymyalgia rheumatica, other side of the spectrum we call it a giant cell arteritis is what you need to remember. Now, whenever hypermagnesemia is there, hyperreflexia is the early sign. It will precede even apnea and coma. A developmentally normal child hopping on one foot, copying a cross and square, tells a story, goes to toilet alone. What is the age, doctor? Typically 48 months, 4-year-old child. Similarly, sitting without support, transferring objects from hand to hand, speaking in monosyllabic babble. What is the age group, doctor? 6 months. All these developmental milestones, mutti mein rehna hai, kal ke entrance ke liye. This is the favorite area of examiner, doctor. Night terror versus nightmare. How do you differentiate? Typically, preschool years, sometimes associated with somnambulism, night walking. Good. Madhuri, Harish, keep punching your answers, doctor, so that you are equally vibrant with the teacher parallelly. Night terrors, they do not occur with REM sleep. Sleepwalking may occur during night terrors and may put the child at the risk of injury. So, fatafat bolo, doctor, this is one of the favorite batti marne wala item aa gaya. Ek football le lo, har ek book mein available hai. But the point is, either baitna hai, man mein baitna hai. Because tomorrow when you are taking NEET PG exam, when a question comes on night terror versus nightmare, you will remember Dr. Murali Bharadwaz. So you should remember, night terror in the first part of the night, whereas nightmare occur in the early hours of morning. Nightmare occur in the REM sleep. There is deep sleep, night terrors occur. If you interfere or you touch it, it will make it worsen. Whereas nightmare, child is upset but he will settle if you happen to touch him. Night terror, the child may get out of the bed, he may become aggressive. Whereas nightmare, he will toss and turn during the nightmare. Night terror, often they won't recognize you. Whereas nightmare, when you wake up a child, hey mama, he will call you. So recognize you immediately. Nightmare, child can be comforted. So night terrors are more a terror for the parents, nightmares are more a terror for the child. So I'm going to leave this literature, I'm not going to read it for you, but आप आपके दोस्त के साथ बैठ के इस टेबल को गर्मा गर्म बत्ती मारना पड़ेगा, नहीं तो नाइट टेरर नाइटमेयर आपके फाइनल रैंक में it will create a night terror. Nocturnal enuresis, 8-year-old boy. What is it associated with? Quite often there is a family history of enuresis. There is a family history of enuresis is what you need to remember. A 18-month-old is noted to assume a squatting position. There are occasional episodes of so there are even occasional episodes which are happening with perioral cyanosis during the squatting period. So the very word squatting makes you to think of tetralogy of fellow is what you need to basically remember. So a 1-year-old has manifesting severe cyanosis right from the day of birth. The infant is having tachycardia, but no cardiac murmur. So what is the most likely diagnosis? Total anomalous venous circulation. Because always whenever you take doctor congenital heart disease, please remember one of the important point. Congenital heart diseases with pulmonary oligemia, congenital heart disease with pulmonary plethora. You have to differentiate. So total anomalous pulmonary venous circulation is associated with plethora. So isolated pulmonic stenosis is being found in a symptomatic patient. What is the initial treatment of choice? You have to do balloon catheter valvuloplasty. Fresh frozen plasma transfusion. So to whom do you want to give? Fresh frozen plasma is a very good source of protein C. So a 1-week-old neonate when presenting with pulmonary purpura fulminans, then such an individual is indicated to receive fresh frozen plasma. Hereditary spherocytosis. What are the best ways that you want to treat? Obviously, you need to do a partial splenectomy not to treat it. And in fact, hereditary spherocytosis also require cholecystectomy if the bilirubin is really high. So that's what you need to remember. A 45-year-old farmer, itchy erythematous papular lesions on the face, neck, V area of the chest, dorsum of the hands, and is more severe in summers, improved by 75% in winters. Always you should think of the possibility of the photosensitivity, which can be tested with photo patch test. Arthritis mutilans. Typically, in psoriatic arthritis, it will be a deforming arthritis, which is called arthritis mutilans. A 30-year-old male complains of a sudden loss of the head, beard, and of the eyebrows. Multiple patchy areas of hair loss. There is no scarring. So alopecia is being divided into scarring alopecia, non-scarring alopecia. So this is a classical example of alopecia areata. So alopecia areata, there is abortive hair growth, exclamation hair mark is the classical feature of this autoimmune form of alopecia called alopecia areata. Hidradenitis suppurativa. So, what is, where do you see hidradenitis suppurativa? Typically, it involves apocrine sweat glands, is what you need to remember. Dermatitis herpetiformis, typically seen in gluten hypersensitivity. So, gluten-free diet with minerals and vitamins need to be given. Topically, which anesthetics can you apply? So, tetracaine, lidocaine, cocaine, they're all topically administered. So, tetracaine, lidocaine, cocaine, emlacrine, which is the eutectic mixture of the local anesthetics, they can be applied topically. Cimetidine decreases the hepatic clearance of the local anesthetics. Bupivacaine, lignocaine, procaine, but not procaine is what you should remember. So, cimetidine decreases hepatic clearance of amide anesthetics, whereas ester metabolism is independent of the hepatic blood flow in cytochrome P450. So, procaine is an example of ester linked, whereas bupivacaine, 2 I's, lignocaine, 2 I's, prilocaine, 2 I's in the spelling. They're all what? Amide. They are only affected with the P450 inducers and inhibitors. That's the point. FiO2 increases approximately what percentage? For each liter per minute increase in the delivered oxygen flow by a nasal cannula up to 6 liters per minute, 4%. It increases by 4%. If you give tubocurare, what is the main side effect, doctor? Typically, it leads to the release of the histamine. Histamine leads to vasodilatation, leading to the development of hypotension. So, D-tubocurare, hypotension, histamine release, vasodilatation. The buzzwords which you need to remember. The last question for today's evening, doctor. Decreased plasma cholinesterase activity seen in liver disease. Which among this is dependent upon plasma cholinesterase? Mevacurium is dependent on plasma cholinesterase is what you have to remember. So, doctor, that brings an end to this long journey that we are having. So, don't forget, every day, Dr. Murali Bharadwaz and all of you, you're all going to sit together, evening, chai pe chircha. And I strongly advise you all to download the Incus quiz app or go to the Incus quiz web app. And there you can be able to log in whether you are an iOS or Android or any Windows machine or anything. Go to the Google Chrome and on the web also you have the availability. You can play the quiz tournaments every hourly and charge your preparation. See you all tomorrow. Thank you.